Hello, today we are going to talk about snake bite. This is the case slide made by Dr. S. Parthasarthi. So I thank him for this slide. So what is the problem statement? Problem statement means why we are discussing about snake bite. One is India has highest number of death due to snake bites in the world, with 35 to 50,000 people die per year. This is the statistics, not actually, because not all cases are reported to statistics. So Pakistan there are 8,200 deaths, Nepal 1,000, Sri Lanka around 15,000. Case fatality rate is people dying of snake bite after admission is around 10 to 20%. So critical points. Then the average age of people dying of snake bite is 30 years. Male to female ratio, male more common than female. Farmers are most affected. They usually seen in rainside floody areas. Usually, if we time means bites during nocturnal are usually crate crate poisoning, and during diurnal are cobras. Bite to treatment delay varies greatly, ranging from 30 minutes to 15 days. 6 hours is common. 50% use harmful first aid measures. Lower limb day bites face in the night. Then there are various types of snakes, but major snakes are Elapidae and Viperidae. So in Elapidae, the rat snakes though look like but are not venomous. In Viperidae, there is wolf snake which are not venomous. So can you make ASV? So this is the crate, and this below is the viper. So it is believed that 100% of the snakes are poisonous. Not so. Non-venomous and dry bites by venomous snakes are more common, 60% of in India. So what is viperidae? Viperidae means vipers. So there is local pain, tissue damage characterized by swelling and blistering, bleeding, necrosis at the bite sites, sometimes extending to lower limb, coagulopathy, platelet dysfunction. They may present with bleeding, including intracranial hemorrhage, persistent bleeding from fang marks, wounds, or gums. The poison contains procoagulase and metalloproteinases. This is the image showing lower limb cellulitis with blebs and bleeding from the bite marks in viper bites. So there is ocular bleed, oral bleed, intracranial bleed, and bilious bloody vomiting. It can also cause acute renal failure, neurotoxicity. In some studies, they have found bite by crates or sea snake do not usually cause signs of local poisoning and can be virtually painless. In cobra and nurse, the cobra venom mainly contains neurotoxin which bind acetylcholine receptor and cause ptosis and sleeping story in the villagers. Neurotoxin causes sweating, salivation, increased salivation, difficulty in swallowing, speech difficulty, weakness of knees, slow progressive diaphragm failure, and death may occur in 30 minutes from diaphragm to paralysis. Great bites causes slow paralysis. Some bites may confuse. Some are myotoxic, abdominalis, and renal failure. Snake do not exhaust their store of venom even after several strikes, and they are no less venomous after eating their prey. What is common and early symptoms of systemic envenoming? The most common is vomiting. It's also called a Mason-Bar tropical disease. First aid. The bite victim should be reassured. The bitten limb immobilized with makeshift splint or sling while transporting the patient. Walking is contraindicated because muscular contraction promote venous absorption. Danger incision big and tight tourniquet are followed. So what to do when we face with a patient with snake bite? That is, do it right. That is, first is reassure that the patient, I believe is that all are poisonous. They may die of fear. So reassure the patient. Hope should give to the patient or the person who has undergone snake bite, then immobilize the affected limb. Next, GH is go to the hospital and tell the doctor about history. So what is wrong? What you should not do? There is sucking, as popularly shown in cinemas. You should not suck the poison. Shock, extreme cold, herbs, washing the wound with soap and water, catching the snake and incisioning the bite wound to remove the. What does traditional treatment say? Constricting band tourniquet may cause pain and swelling, and condition suggesting low envenomation. Ingested herbal medicine may cause vomiting. Installation of irritant plant into eyes may cause conjunctivitis. Forcible insufflation of air in respiratory may lead to pneumonia, bronchospasm, rupture of eardrum, and pneumothorax. Incision and cauterization immersion in scalding liquid and heating over fire can result in devastating injuries. So, clinical diagnosis: how do we diagnose snake bite? Is fang marks identification. Uh, we identify the snake or based on history. Snake dead or brought misidentification is the problem. Tourniquet or venom has caused necrosis. We don't know if we tie the limb tightly. So non-venomous snake can cause cellulitis syndrome. Local poisoning will lead to bleeding and clotting disturbances in viper day, and swelling, bleeding, clotting disturbance, shock, and acute kidney injury in vessel viper. Local limb paralysis in cobra. Paralysis with dark brown urine and acute kidney injury usually seen in great sea snake and viper. Sometimes they don't have any symptoms, but they may present with low back pain, tenderness in case of snake vagina, renal ischemia. So, what is when a patient comes to hospital, we usually do a 20-minute whole blood clotting test, and blood is removed and kept for 20 minutes to see the clotting thing. If the blood clots, usually it should clot within 20 minutes. If it is not clotting, then there might be prolongation of bleeding time by snake poison. So, what other test we can do? So we can do prothrombin time, APTT. Some studies they use thromboelastography. Then broken neck sign. Here look for the broken neck sign which causes paralysis of neck flexor muscles. So head falls back. So what are the other tests is PCR amplification, which are a bit costly and not available all cases. Some patient may present late after 8 hours. What is the management? Should give injection tetanus toxide to prevent tetanus, then antivenom and antibiotics. The other mainstay of treatment is antivenom. How antivenom is usually available for cobra, viper, commonly available species. And how do you understand? The initial recommended dose is 8 to 10 vials administered over 1 hour. Repeat dose after 6 hours in hematotoxic. In neurotoxic, 1 to 2 hour. Maximum recommended in 20 vials in hematotoxic and 30 vials in ASV. So, as such, these guidelines to practical scenario is innumerable species. So, the cost of antivenom in Rwanda is around $8 to $10, which is equal to several days' salary of poor pharmacists cannot afford such 10 to 15 vials. So, children need same ASV dose. Snake inject the same venom. So, injection of Advil hydrocortisone. Do we need test dose? Test dose is needed, but even if there is test dose, we have to use it using other measures. If there is intracranial bleed going for initiation, we should give 25 vials over a period of 1 hour. So, what are the dangers of anti-snake venom? It causes fever, shaking, chills, nausea, vomiting, diarrhea, abdominal cramps, tachycardia, hypertension, bronchospasm, and angioedema. Continue administering adrenaline titrated dose of 0.5 mg IM. Once patient is required, ASV can be started in 10 to 15 minutes. Maximum 20 vials of ASV in neurotoxic and 30 vials in hematotoxic. If the patient is not breathing, they should be intubated and ventilated. FFP if there is bleeding derangement. So ASV acts for 90 hours, so no need to repeat. Next is the neostigmine test. 2 mg neostigmine IM with 0.6 mg atropine observed per 1 hour, single breath or opening mouth. If victim responds to neostigmine test, then continue with neostigmine plus atropine 8 hours continuous infusion. Drug should not be used in microbeds, heparin and phase. Complications are hypotension, hemorrhage, vasodilation, cardiac depression, sepsis, pituitary adrenal. Treat the cause. USG guided absolute central vein canalization or traumatic central vein canalization. Sometimes low dose dopamine may help. Beware of repeated vein puncture to take by question. No arterial puncture in bleeding patient. Healthy patients urine output is good enough. Surgical fasciotomy role is nothing in terms of compartment syndrome. Then nothing before coagulation stabilizes. Even ASV decreases edema and need for fasciotomy. Other complications are persistent bleeding, renal failure, cardiac complications, stiffness.